TEDx events generate so much optimism, but I have some bad news. And actually, don't laugh because it affects all of you. The bad news is that all of you will get sick someday. It doesn't matter who you are, it doesn't matter where you went to school, whether you're from Springfield or not, or how much money you have. You'll be sick someday. We will all be sick someday. The good news, of course, is that others have walked this path. And for most of us, the diseases that we have, or the diseases that we'll get, have affected other people. And we can learn from their experience. 70 years ago, my grandparents posed for this picture in my hometown of Nagpur in central India. My grandmother was actually expecting when this picture was taken, and my mother was born just a few months later. This picture is our starting point because it's a snapshot that helps tell a story. The story of how the basic scheme of healthcare has been unchanged, at least since the time of my grandparents. Healthcare in most parts of the world involves a doctor, a patient, and a network around them. It's a one-way monologue. No one asks the patient for advice. Almost nobody thinks of the patient as an innovator. This is a paternalistic order that the world just accepts. And despite all the amazing changes that we've seen in our lives over these decades, our relationships with our doctors is pretty much the same. Now, I'm sure some of you here are thinking that you are active participants in your health. And that may be true. I would imagine some of you have personal electronic health records. Some of you might have even had your DNA sequenced for $100 on the internet. But I can assure you that you are a minority. We in this room are a minority. For much of the world, healthcare is still delivered the way it was delivered when my grandparents stood in front of that photographer over 7 decades ago. So I'm here to paint a different picture, a new model, where patients aren't just patients, but they're innovators. And they're not just innovators, but they're innovators in their own health. So let me pose the question, why should patients be innovators? How does innovation even work in healthcare? The story of innovation in healthcare is really the story of innovation anywhere else. The same rules apply. When we first tackle hard problems, we have to follow a process of trial and error to find solutions. This is how many homegrown solutions are developed and homegrown remedies are developed, like having ginger ale if you have an upset stomach. Then, when we can measure a problem, we look for patterns in coming up with solutions. And actually, many diseases today are in this format. It works for 500 people, so it probably works for you. And finally, when we understand how a disease works, we understand true mechanisms, we can come up with a rules-based process that works reliably and works every time. If you break a bone playing soccer, we know what it is, and we know what to do. Recovery is almost always guaranteed, and that wasn't the case 500 years ago. So we've seen this innovation path unfold in many diseases, but most notably in tuberculosis or TB, which was one of the main causes of death in most of the world about 100 years ago. In the 19th century, a lot of people died from something called consumption, where they would cough all the time, have fever and chills, and become extremely weak. The disease would literally consume the patient. And there was no help available other than sunlight, good nutritious food, and rest. And it didn't work. Once we understood how to measure consumption, using devices like the stethoscope, using technologies like the X-rays, we could see patterns. We understood that consumption was really a whole set of diseases hiding behind one. These included TB, lung cancer, bronchitis, many others. When my grandparents were young, the world knew the patterns behind TB, but help wasn't available, nor was it always reliable. And it wasn't until we understood the bacterial mechanisms of TB and that we learned how to use antibiotics to treat the disease that we truly had a handle on it. And once the technology became much more widely available, TB became a rules-based treatment that worked always and worked reliably. Unfortunately, my grandfather, who was pictured earlier, didn't live to see this transition. But my grandmother did. It happened in one lifetime. It happened in her lifetime. There's a Harvard Business School professor that studies innovation. His name is Christensen. And he describes the evolution in every disease in the following way. He calls it intuitive medicine that gives rise to probabilistic or empirical medicine that leads to precision medicine, which are essentially different words to describe what I just told you. Over time, every disease has to follow this path. This is the path of progress. One of the important dimensions is time, and the time allows the technology to move the disease knowledge forward. But we should also consider another dimension, and that is cost. When we move from the intuitive world to the precision medicine world on the right, a very interesting thing occurs. Our costs actually go down. We can get better treatments for less money. And that is the real wonder of innovation. Better doesn't always have to be more expensive. And the sooner we can get diseases out of the intuitive world on the left to the rules-based world or the precision medicine-based world on the right, the faster we can improve quality while reducing costs. In the case of TB, this move produced some dramatic results. It reduced TB from a leading cause of death about 100 years ago to a disease that had relatively limited impact in recent times. And by the time my grandmom passed away in 1987, TB was a well-controlled disease that had a minimal impact on public health in the world. We hear a lot about payment reform. No amount of payment reform can match the advantages that we can get from this kind of change. So there are only two things we need to do. We need to measure a disease, so we can move away from the intuitive world onto the probabilistic world and look at patterns. And then when we can measure the disease, we want to understand it and develop treatments. And patients can help us with both. Patients live with the disease on a daily basis. And so if we provide them the right tools, they can help us measure a disease. And when we use those measurements to understand a disease and develop treatments, patients can help us validate those treatments and tell us if they work. And not just in a clinical trial or a controlled experiment, as most of the medical community works today, but in the real world. That's where it matters. Healthcare innovation, I would argue, is crucial to our well-being as a society. And patients are crucial to healthcare innovation. So that is the idea that my team and I are working on at the firm we work at in Cambridge, Massachusetts. We are working on ways for patients to find others like them, to learn from each other, and to document their unique journey so that healthcare researchers and other patients can learn from them. If you're a caregiver, as I'm sure some of you are, you can document the journey of somebody that you're caring for. This is an example of a patient profile. Earlier in the morning, we saw data being used for education. This is data being used in healthcare. But it's patient-reported data that doesn't exist in a clinic. It exists in your own home on your own computers. You can see that people share a lot of information about their condition, what impact a disease has on their lives, what treatments they're taking, why they stopped taking a drug. This is really valuable information. They're recording outcomes and talking about side effects of a drug, the burden of payments. And this is information that the healthcare community can use to develop better products, to innovate. Much of this information you cannot find anywhere else. Patients can search for other patients like them, communicate with them, share ideas, provide words of encouragement, and learn how to deal with a problem. In some cases, patients even share jokes, because this is part of the broader experience of having a disease. Patients sharing data, patients sharing stories, and those stories being converted to data that the best brains in the world, no matter where they are, can analyze. In this world, patients are not backseat travelers. They're actually fellow explorers in the journey to find better health. The history of innovation teaches us that most solutions like this start as good enough. They're never perfect. But that history also teaches us that these solutions get better over time. And that's what we're working on. Our ability to learn from the patient voice and to apply what we learn has to get better over time. And that's what we intend to do. This is actually an idea that started with one patient, the brother of our two founders who passed away due to ALS. But the same idea is now working for about 250,000 people at our network. Some of our members, of course, given the conditions we focus on, have passed away. But their data lives on. Their stories continue to help and inspire. Even in death, these members are contributing more to science than has ever been possible at this scale before. And in fact, just to illustrate the point, a few weeks ago, I saw an update from a member that had passed away. It's obviously odd to see an update from someone who's no more. Turns out his wife had logged into his account to update his status and to tell his friends of his passing, just about a month after he died. And obviously the community was very important to him, and so she knew that. And she knew the work had to continue. And it's a very humbling thought when you think of people logging into a website to update a status on someone's health when the spouse has passed away. It shows their level of commitment. And it shows us that they can put aside their own suffering to contribute to a greater good. And of course, this is a very early example of how we can make patients involved. So I did a little experiment in preparation for this talk. I made a tag cloud of disease names, and these are diseases that are named after people. And you'll see that a lot of these diseases are actually named after doctors and researchers. Very few, actually one, are named after patients, and only when the patient is a celebrity, like Lou Gehrig. And I'm sure you're not surprised to see this, because the history of innovation in medicine is often told as the story of doctors. These are the people that we have known to be at the frontiers of medicine. But I would argue that the real frontier of medicine is actually in the lives of people that live with the disease. Their belief that they too can contribute to science and their ability to put aside their distress in order to do so is an expression of the spirit that drives humankind. This is the spirit that drives us to find solutions and to solve hard problems. And what we're doing in creating these technologies is we're supporting this spirit. Now, if you think this is important and if this is valuable, think about how you can get involved in your health. Think about how you can document your journey so that someone someday in the future can learn from you. And if we get enough of you involved, we can really make patients innovators in their own health. Thank you.